and one of the ambassador coordinators. And just a little bit about myself. I went to the University of Michigan for undergrad. I graduated in 2020, and some things that I'm involved in on campus is obviously the ambassador program. I'm also the part of the cardiothoracic surgery interest group, and I'm part of the medical research elective. So if anyone has any questions about that, they can ask me. A little bit about why I chose Wayne State. During undergrad, I got involved in a service learning program called the Downtown Boxing Gym. It was an after school tutoring program and enrichment. And I just kind of fell in love with the city. It gave me the chance to explore around and meet some of the people here. And I just knew that Wayne State was kind of where I wanted to end up. So yeah, and we can go ahead with Layal.
Hi guys, my name's Layal, like Nico said. I am in M2 right now at Wayne. I graduated 2021 from University of Detroit Mercy, so that's also in Detroit. It's pretty close by. Some things that I'm involved in on campus, just like probably everyone else here, I'm part of the Wayne Ambassador Program. I'm part of medical education research. I am on board of our AMWA, so that's the American Medical Women's Association, as the speaker chair. And then I'm also our class treasurer for Student Senate. I think that covers almost all of it. And then as for why I chose Wayne State is I also went to school in Detroit, like I mentioned. So I had fallen in love with the city just like Nico, and I did a lot of volunteering around this area, which is just something that I wanted to continue with my education, is working within an urban city. So it was kind of just a perfect fit. And I did the early decision program and it worked out really well. Yeah, that's it.
Hi guys, my name is Shirley. I went to undergrad at Wayne State actually, and I'm an M2. And the things I'm involved in on campus, kind of a long list. So just ask specifically if you're more interested in something. But I'm an AMWA, like Layal, Warrior MD ambassadors, like all of us. I do a few different research projects. I'm in 3 different labs at the moment. I'm the outreach chair for our Refugee Outreach Collective, which is a new organization we just started. I am in the business and medicine elective if you're interested in that at all. I'm the clinic coordinator for Make Your Date, and I'm a peer mentor for our learning communities. I also work part-time on the side, if that's something anyone has questions on, at a local restaurant. And why I chose Wayne State is because I went to Wayne State for undergrad, so I knew I really liked it. And I definitely fell in love with the city, but even beyond just the city of Detroit, I really appreciated how much Wayne State emphasized clinical experience compared to a lot of other medical schools, and how hands-on we're allowed to be even as students, so that by the time I got to residency, I would have a lot of experience and feel confident in what I could do helping patients. And yeah, I think Sarah is next.
Hi, everyone. I'm Sarah. I went to Michigan State for undergrad. I graduated in 2021. I'm an M2 this year. In terms of things I'm involved with, obviously MD ambassadors. I'm also on a couple different research projects at Henry Ford. I'm the president of Medicine in Motion. I'm on the e-board for the Medical Student Garden. I'm also in the research elective. I think that's it. And then why I chose Wayne State is really, it seems like Wayne is really incorporated into the community. I grew up in Michigan from the other side, but I wanted to live in a city and not just live there, but also to work in the city and get to know the population. So from clinical experiences and also volunteer experiences, it's all very focused around the city of Detroit. And I feel like when I'm leaving Wayne State, I'm going to be really making a difference in this city. So that's something that stood out about Wayne that ultimately led to my decision to go here. And then I think that's also next is Annie.
Hello, everyone. My name is Annie. I'm an M2 and I graduated from University of Florida. I think I'm the only out-of-stater so far. But right now, I am obviously involved with MD Ambassador. I'm also involved with the Asian American Pacific Islander Medical Association, or APAMSA. Um, I'm also involved with like a couple of research projects at Henry Ford as well, also in the business elective. And the reason why I chose Wayne, from like an out of state student, I grew up in like a small city in Florida, so I wanted to go to like a bigger city for med school, for a more diverse population of patients. And Wayne gave me that. And it's kind of cool living in a big city too. So that's why.
So I think I'm last. My name's Julia. I went to undergrad at Wayne State and graduated in 2021. And I'm an M2 now. I always forget when I start listing these. So WarriorMD ambassadors, AMWA. I'm a learning coach, so that's just kind of like a tutor / helper for some of the like other years, like M1s and stuff. And then I'm in the med ed research elective, and I'm the education co-chair for LGBT people in medicine. And then I'm the president for STI education, STI HIV education and prevention. So pretty much everything I do is related to education. And why Wayne State? Well, I went here for undergrad, so I already kind of got the vibe and had the energy, and I like was able to do some like research at the med school before. And so I like kind of like, I don't know, I like can't explain it other than like the energy. Like I just felt like we have like a very collaborative over competitive energy. Like it's much more like people want to work together rather than like compete against each other, which was the energy I was looking for.
Thanks, Julia. So a little bit about this session. We want to keep it very informal. So like we obviously want to hear from you guys, hear your voices. So if you have a question, feel free to use the little hand raise function that Zoom has, and then we'll call on you and we can just like have an open discussion about your question. So I guess we can go ahead and start. So we'll just open the floor to questions. Yeah, video.
Hi, thanks for doing this. I was wondering, for the ambassadors who took a gap year, like how did you use that time, and like how did you talk about it in your application and things like that?
I guess I can go ahead and answer that. So I took a gap year. I graduated in 2020 and I started medical school in 2021. And so I guess in my applications, I talked a lot about like research, because that was the main thing that I was focusing on during my gap year. I was doing research at the University of Michigan for a cardiac surgeon, and it just gave me, just tons of topics to talk about in terms of individual research projects that I was working on, the physicians that I was meeting and connecting with, that not only just the University of Michigan, but like other academic institutions like Northwestern and stuff. In general, I would try to focus on, things that were meaningful and things that you felt enhanced your gap year, because, a gap year isn't a detriment to your application. It could be seen as like an extra year gaining experience, generally extra experience. And if anyone else has something else to say too.
I actually took 2 gap years. And one of those years, well, 1.5 of those years, I did like a master's degree with like a university nearby. And basically the master's program, they had us like take the same classes with the medical students at that school. So I got a lot of exposure of like medical school level classes, which was great. And then after that, I was going to apply, but then COVID just hit and I didn't want to go to medical school during COVID. So I just waited a little bit more. And I think the way that I put it in my application was obviously I told them about the master's program and how much more prepared I would be. And then COVID is just like, it's just an unfortunate event for everyone. So schools were being very understanding of how you have to stop doing certain things when COVID hit. So definitely gap years are not that like a bad thing if you play it well in the application.
All right. Hopefully that answered your question, Vidya. Let's move on to Disha. You can go ahead with your question.
Hi, everyone. Thank you so much for doing this for us. Really appreciate everyone's time. So one of the things that I found really unique about each and every one of you is that you're all really involved in a lot of different things like on your campus, which I think is really awesome. A lot of times I've heard that like medical school kind of makes it really hard to do that because of like how much studying you have to do and kind of how fast the coursework comes. So I guess kind of a two-part question. Do you think that this is kind of maybe a little more unique to Wayne State, that you guys are able to balance those responsibilities a little bit more? And like, do you think it like supplements your education, I guess, or kind of, yeah, that's, yeah, kind of what I'm, thank you.
I can take this one. Yeah, so I remember when we started as M1s, they had like in our orientation week, we had a student org day. And I remember an M2 saying like, try to only become like e-board of one org to start off with. And I was like, to start off with, like, I was like, there's no way like I'm going to be on e-board of anything. Like, how am I going to have time to do any extracurriculars? Like, I was super overwhelmed by the idea of that. But the nice thing about Wayne is a lot. So one thing that you do in our curriculum is you do outreach hours and clinical hours. It's part of our required curriculum. And a lot of those are run by our student organizations. That's how you get those hours. So inherently you'll be interacting with a lot of these organizations. And then for me, I like tried not to like rush myself, but I saw which organizations I felt passionate about and which ones I was genuinely enjoying my time doing, so that these are things that weren't horrible for me to work into my schedule. And another really nice thing about Wayne is a lot of organizations like to work together too. So you'll get to have a lot of different overlap. So I felt that I was introduced to a lot of the organizations through the curriculum that you're already required to do. And then and I think that's true probably for a lot of us, that after that, we were able to kind of lean into more areas that we were more passionate about, but you're introduced to a lot of these organizations inherently. And I think that's something that Wayne does really well as far as making getting involved in extracurriculars relatively easy, I felt.
Yeah, I think just to add on to that, a really great thing is like you can't technically really be on a board position in your first year of med school. They kind of give it to you as a transitional period, and right around like I want to say maybe like late October, November, all of the orgs will send out like applications to be on their following e-board. So it's always like a second year to first year transition for e-board positions. So you won't really start your e-board position till like January of your like M1 year. So it gives you a lot of time to kind of like get a handle on first year before like you hold a position. So it's kind of like comforting knowing like no M1 is holding an e-board position, not until like your third block, which is really good. And then all the M2s will always be kind of like on the back burner once you take over a new club for like help. So even though the M2s, which then become M3s, are like still occupied, they're still there if you need them. So it also just kind of like helps take over those positions easier because you have someone to ask all the questions to.
Also, don't worry about the time commitment because I guarantee you everybody knows that med students are busy. So the time commitment, it's different for every org, but the time commitment for each org, they're not that huge compared to like undergrad orgs. So I think for each org, for me at least, I have like 5 to 6 hours per month per org. And that is completely doable. If you like manage your time well. So they're not like undergraduate orgs at all.
And just one final point that I wanted to bring up. I know that a lot of you are thinking ahead to the future, and so medical school applications and residency applications are, coming within the next 5-6 years. One thing that I wanted to say about the student organizations is that you want to have meaningful experiences in all of them, and you don't want to use them as like check boxes, like, oh, I'm on the board of this, because residency applications use way more like, what can you say about it, rather than, oh, this is what they did. So you want to, I think what Layal brought up, and where you have the grace period of figuring out your M1 year before you sign up to do any of these board positions, is that it's a great time for you to explore those explore those groups individually, find out, what you best fit with, and something that you want to continue doing. And yeah, hopefully, Disha, that answered your question. We can move on to the next question from Yeonju.
Hi everyone, nice to meet you and thanks for making the time today. I'm really interested in research in underserved populations and health disparities and kind of gaining education and experiences in that context. I was wondering if any of you could speak to doing research in that kind of topics, or just research in general at Wayne State, and how you found mentors and opportunities and things like that.
I guess I can take it. I can't necessarily speak to research for education in underserved populations, I believe what you said, but I know that during your M1 year, you're presented with a bunch of different electives. There's like the medical education research elective. There's the clinical research, or the medical clinical research elective, which I'm a part of, and a few other ones. I know the business and medicine, but that's not necessarily probably the research that you're looking for. But to make my point, through those, you have a lot of different networking events where you get put in touch with mentors, and you can actually sign them on as your official mentor, and you'll be working under them as they're your PI, and you do research all throughout your 4 years. Alternatively, if you want to do, say, like the business and medicine elective, but also still want to do clinical research, all of the doctors here and physicians are very open to having any medical student join them, regardless of whether they're in the electives or not. I know that my research mentor, I didn't actually find through the networking events that were held for us. I literally cold emailed him off of LinkedIn, and he was very happy to reach back out to me and sign on as my mentor, and now I'm doing research for him. So there's a bunch of different options about how you choose your research and how much you actually want to do in research, and it's very autonomous.
Yeah, I can add, I'm not in the research elective, I'm in the medical education research elective, and so is Layal. And I can say that while we don't deal directly with health disparities, what we do is we have curriculum projects on how to enhance our curriculum to serve a need we see, and a lot of us, depending on, everyone chooses a different project based on your interest, but a lot of us end up doing projects on how do we make our curriculum better serve or better understand different underserved communities, or accommodate better, or what understanding what things doing. I don't know how to describe it. And then there's a lot of just outreach to underserved communities outside of research. I know because I do STI and HIV education and stuff like that. Detroit is a hot spot for HIV, and it's a very underserved population. And so there's a lot you can do outside of research and like working with health disparities. But yeah, and then I know like Shirley Make Your Date does a lot with like maternal mortality. Yeah. And that's research, sorry.
One last thing to even add on, a lot of clubs themselves like do research projects. So even just being a part of an organization is another great way to do that. So like, I know for AMWA, we have our own kind of like research project looking into, not quite remember, but I think it's like looking into like pregnancy during like residencies and like how people get kind of like maternity leave and things like that, and whether or not that like affects like ESMO that can affect like getting into certain residencies, because it's not technically fair, right, to like have those kind of discrepancies. So a lot of clubs will do research like even within the community. So that's definitely like something you can easily be a part of.
Thank you.
We can move on to the next question. You can go ahead, Matt.
Hi, very nice to meet you all. I just had more of a general question. I'm wondering what the biggest thing you wish you knew before applying to med school was.
I guess I can start off. So for me, one of the biggest things that I noticed once I was deep into the process of applying was how much of a comprehensive story you want to have in your application. So what I mean by that is starting as early as you can, as building a story that makes sense of your path from discovering that you like medicine, joining clubs and exploring your interests that are related to medicine, and then now you're applying to medical school, making sure that the things you're doing are all kind of narrowing you down the same path, ending you at medical school, and then ultimately why you want to go to that medical school specifically, you write in your application. But just, I guess I was looking back and I found a bunch of sporadic volunteering that I did for one summer, and then I volunteered here for a summer. And while it was all medically related or all relevant to helping the community and all these things that medical schools look for, it wasn't exactly the comprehensive story that I wished I would have had, that really would have been able to, I guess, just make my personal statement and make my entire journey into medical school make more sense.
I will also just add on, I feel like reflection is a really big part of like your application process, is like reflecting on your own experiences. Because like, for example, I had like done research in undergrad, and it kind of like, I really had to like sit there and think about it of like, why was this beneficial for me? Like, how does this translate into going to medical school? Like, and the fact that it was something that I wanted to continue, but in a different way, because I did organic chemistry research. It's not really medicinally related. But I had learned a lot in it that it like kind of like taught me like certain technical aspects that I could apply like other research, or just the fact that I got to go to conferences. But I feel like it's just a lot of reflection on like how each of your experiences has kind of like shaped who you would be as a doctor. I feel like it's a big part of it, because you can like look back, like even I had to like volunteer with kids for a while, and it taught me a lot of patience. And kind of that quality of patience is something that I know you need as a doctor, right? Because like sometimes you have patients who are in pain, and you have to be very patient with them. So I think there's just like a big thing is like reflect earlier on, because like it's really hard if you're like cramped for time and someone's like, reflect on all your experiences in 2 days and tell me why it's going to make you a doctor. It's really hard. So like if you have the time, like reflect even as you go, like say you have an experience you're doing now, like reflect as you go on. It's really helpful.
Yeah, I'd say one last addition. When I wrote my application, realized as I was writing, like my personal statements and my activities, that I wanted to apply arguing what type of doctor I wanted to be, rather than just why I wanted to be a doctor. And I think once I made that distinction of like, and as a doctor, like almost like just telling them you're going to be a doctor, and then as a doctor, I want to do X, Y, and Z. And I think specifically at Wayne, like this fits those desires of the type of physician I want to be. And that kind of was a helpful realization for finishing that aspect of my application.
And thanks, guys. That was a loaded and very good question. We actually got one in the chat can you speak on Wayne Med's class schedule for students? Also, do you have any advice for secondaries? So I could speak a little bit on Wayne's schedule. I guess maybe what you're looking for is like the daily schedule. So you, as an M1, you start around July, like right after the 4th of July. And they work in, or at least Wayne's school works in 12-week blocks. We call them segments, I think. And so your first 12-week block is the Human Body Foundations, Human Body Foundations 1. And you basically go through each of the organ systems. And in your first year, you're focusing mainly on the normal anatomy and physiology. And like the weekly schedule, there's about 3 lectures that you are given a day. They're all asynchronous. So you can watch them really on your own time whenever you have time. And then throughout the week, you'll have things like your gross anatomy lab where you'll go in and dissect for a couple hours. You have your histology labs and all of the other, you know, like things that are supplementing the information that you're learning within your lectures. And hopefully that kind of helped or cleared up the question. And for advice on secondaries, I'll open this up to everyone else. I know we spoke a little bit on what you hope you knew or what you wanted to know before applying, so.
I mean, I guess it's like what you've created in your personal statement is kind of like your story means what a lot of people were saying, like this is like why I did the things I did, and this is like the complete narrative of things. And secondary is kind of, well, for like the why Wayne State and stuff, it's like why like this school is helping me continue to be the person that like I'm like going to be, and why like I don't know, like it'd be like a good and reciprocal partnership, and like what I don't know, just I guess like what you will bring to like Wayne State, and what you feel like, I don't know, just like the fact that you want to have like some level of like who you're going to be as a doctor like figured out, and how like Wayne State is going to help you be that person, and how you're going to serve this community. And Wayne is very big on like urban clinical excellence, so you definitely want to like incorporate those concepts.
I think also just your secondaries are a great way to kind of tie in like your past with like your future at Wayne. And it's kind of, you're kind of already proving to them, like I already kind of like my past 4 years in undergrad, or 5 years if you've taken like gap years, 6, whatever, how many years it is, like have all aligned with like the mission and vision and everything that Wayne State stands for. And you're kind of showing how those like bleed into one another. And that's kind of like what would make you a good fit for Wayne, and Wayne State a good fit for you. Because you don't want to go to a medical school where the things that you want, they're not offering. So it's like a great way to even tell them like do your research, find like very particular things about Wayne, like that are important to you. Because like if you're just going to say research, well, like what about research is important to you? Or what like specific thing does Wayne have that you think would benefit you, or something you really want? I feel like is really helpful than just, besides just being like a cookie cutter like secondary of like, oh, I like research and I like volunteering. Well, what about like Detroit volunteering or urban volunteering, or like street matter clubs? Like look into it and like find what like really matters to you here, and what you would like about coming to this school, because I feel like that really does make a difference.
We got a little clarification thing in the chat from Jack. Yeah, so Wayne specifically, I'm not sure exactly how the curriculum is at other medical schools, but for Wayne, your years are split up into 3 segments each. So you'll have Human Body Foundations 1, 2, and 3 throughout your first year. And I know that a bunch of different medical schools kind of use the normal versus abnormal curriculum in your first and second years. So I'm not sure if that's Wayne specific, but that is how we do it. And I do like the way that it works. So for example, Human Body Foundations 1 is your MSK, so musculoskeletal, and so you learn all of the normal anatomy, nerves, all of the muscles, and all of the normal physiology. So all of the biochemistry behind it and everything. And going on into your second year, which is exactly a year after that, you'll do MSK, pathophysiology, and microbiology. So things that, you know, are actually disease causing and really diving into, sorry, I'm having a little bit of a,
I think I can even just like a good clarification, like a good example is I have a friend that goes to Case Western's medical school. And for example, they do case-based learning. So they usually do things in like chunks. So if they're like illness-based learning, they'll give them something and then they'll learn about that. We can do their own research. Whereas in Wayne, you're going by, as like called Human Body Foundations, you're like learning by organ system, but you're not just learning only anatomy of like MSK and then you move on and learn anatomy of something else. You're learning like the anatomy, the physiology, the histology. So everything will correlate across the board, which in my opinion, I think is like really beneficial because learning like cardio in September and then learning the cardio drugs in like December, like it doesn't help tie them in. Whereas like when you're learning about the diseases and the pathophysiology and the histology and the pharmacology all at the same time, it's like really good at tying things in. Which I think is like a really good way to learn them. And then when you get into M2, you're almost like redoing them, but now like illness-based. So you've already built that foundation. And then you're kind of like learning all this very specific diseases and like how the diseases arise and their symptoms and how you would treat them. So I think like that's what would differ between this school and other medical schools. And we have a bit of like an accelerated curriculum. So like we finish M1 a little bit before other students, and then we finish M2 also earlier, which I think is the added benefit because it gives you a little bit more time to study for STEP, and it gives you like a little bit more time off, I think, later on. So you also start your clinical rotations earlier because think about it, everyone is applying for residencies right around the same time. So it gives you a little bit more time to have an extra rotation or something else in that you can talk about in your residency applications.
And then one like just quick addition to that, just with like everything being tied together. And I know there was like questions about like the schedule and stuff. Like you do have like 2-3 lectures a day, but you also like they correlate like everything together. So like your gross anatomy, your clinical skills, like when you're in cardio, you're learning how to do a cardio exam and like cardio diagnostics and clinical skills. You're doing your cardio lectures, and then you're like in year 1 dissecting the heart. Like it's like everything's like very coordinated together.
Yep, and Don also posted in the chat for anyone who needs it, the actual like year schedule for the M1 students. So you can take a look at that too. But yeah, we can, I think, move on to the next question. So Sushma.
Hi, I actually had a question about a specific Wayne secondary. So the one that asks about which of your experiences or activities align with Wayne's mission. Are you looking for more of a cultural background, or are we trying to relate like our work and activity statements to Wayne's mission?
I'll answer that since I'm from admissions. So we're looking for you to, first of all, understand what our mission is, and it's on the website. You have to understand our mission and tell me which activity relates to that. It doesn't have to be from an activity that's on your application. It could be something else. But how does your experiences in the past relate to Wayne? So really having to know our mission and then finding which one can, and you've got, I don't know, 250 words. So that should be the easiest one to pick out if you've done any experiences with underserved populations, anything in a kind of a clinical realm, you should be able to piece something together.
Okay, thank you.
You bet.
All right, thanks Sushma for your question. We got another one in the chat. What are the main underserved communities Wayne's med school students will get to serve, And what is the main population for the Wayne's Hospital? This is hospitals. Oh, yeah, you can go ahead,
Okay.
Sarah.
Can you repeat the question one more time?
Sorry about that. What are the main underserved communities that Wayne students get to serve? So I guess we'll start with that one.
Okay, I can start off with that one. So obviously I can't list all of them, but I think one big population that we serve would be the homeless population. So I know that there are a bunch of different organizations and a bunch of different clinics that provide, say, free healthcare services for, there's a bunch of different cultural groups that they provide them for, or there's an organization called Street Medicine where we'll go to, for example, there's a YMCA interim house for unhoused mothers and their children, where we go and we provide them with free medical care and free medical supplies, advice, all of those things, basically like they're seeing a physician, but it's all free. So I think that as well. And then also Street Medicine will go on bikes into the community, actually drive around to individuals who are experiencing homelessness, who may be sitting on the streets or anywhere that they find, and offering them the option to have medical care if they would like it. So yeah, I think the homeless population, especially in Detroit, is a big one that we serve.
Yeah, I can also jump in real quick. So we did the Refugee Outreach Collective last year to specifically serve the refugee population in Detroit and its surrounding cities. So there definitely are a lot of different minority populations that we serve. I would say both ethnically and socioeconomically. But a lot of what our focus is in different clinics, and I can especially speak to the Make Your Date clinic, is education. There's a huge gap in medical education, which I know is why the med ed elective even exists and things like that. But a lot of our Detroit residents didn't have even a primary care physician until something comes up. So there's a lot of gaps in medical education for our patients, even things that you may assume are a given. So that's a really good opportunity that we have to get to provide that education. Make Your Date is specific to moms and their babies. So we work a lot with the pregnant patients, and sometimes you're giving pregnancy or no, like, I guess, non-pregnancy related medical education, just because they don't even know about like proper diet or exercise and things like that. So those are some really good opportunities that we have. And there are a ton, like Sarah said, there's a ton of different populations to serve, but it's nice that you can kind of find your niche and see what you'd like to, I guess, focus on.
Thanks, Shirley. And so the second question is, what is the main population that Wayne's associated hospitals serve? And I guess that's kind of a more all-encompassing. So the two hospitals that Wayne works with is the Detroit Medical Center, or the two main hospitals that we work with are the Detroit Medical Center and the Henry Ford Hospital. And those two essentially serve all of Metro Detroit. And so you'll see all of those populations that were previously mentioned in the clinics. They're all coming to those hospitals for help for any of like emergency needs, or even the primary care clinics that you'll be rotating at. So I guess specifically you're serving a more urban population, which is one of the pillars of Wayne Medicine. And yeah, hopefully I think that answers your question. Also, Don posted in the chat for anyone who wants to take a look, the student organization's website for Wayne. It's our Get Involved website where we just have our list of student organizations and their signups and what they're involved in. And, you know, yeah, we can move on to the next question. Sorry if I'm getting your name wrong, but Khadija?
Hi, yes. My name is Khadijah, and I'm currently 16, and I'm going to be applying to medical school next summer. So I wanted to know, will I need a parent's signature on anything?
I'm not sure if I can specifically answer that.
Maybe
Dawn?
Dawn.
Yeah.
Okay, sounds
Yeah,
good.
as far as what parental information will be needed, that I don't know. As far as admissions, there's nothing that will necessarily be needed, but the registrar's office and that type of thing may have some requirements.
Okay, thank you.
All right. Hopefully that answered everyone's questions. Is there any questions that someone wanted to bring up? Or if you don't feel like,
Actually received a question, so I'll just answer it publicly in case anyone else had this. So I did the early decision program, and the question I'd received is why I chose to do the early decision program and how I knew it would be a good fit for me, or at least for Wayne, and like why that was something I chose to do instead of apply to all schools, including Wayne. So it's definitely not an easy decision to make for anyone thinking about it, because you are almost putting all your eggs in one basket by applying solely to one school. However, I will say for me, like I had mentioned before, I had went to school in Detroit, and it had really made me realize that I wanted to work in an urban population, not like necessarily truly Detroit, even though I did like love Detroit and I did want to work here. But when I was initially just thinking of applying, when I was just searching for schools, I was looking for schools in an urban population. And I always knew there was Wayne State, but for example, there's a lot of other schools in Michigan. Some work with more rural communities, but I had really just wanted any school that was in an urban area. That was a big part of it. I think another big part of it that was like, that made me realize like I had wanted to go here was I kind of had the thought of like, okay, if I were to get in to like 5 schools in state, out of state, which one would I pick? And at the end of the day, for me, like I still would have chosen Wayne as my first choice. So I think for me, like inherently doing it wouldn't have made a difference, because like this was like my end game medical school, and I had wanted to come here no matter what. And if it was like between here and MSU, I still would have picked Wayne. And 2, I also knew like that I would be a good fit for Wayne as much as this school would have been a good fit for me, based on just like all of the experience I had like almost indirectly, like the stars had aligned for me to come to Wayne State. If that's like, I'm not sure if that's like the best way to explain it, but like all of the experiences that I've had in Detroit and with underserved communities, and like the research that I had and like my MCAT scores kind of like made it like a perfect fit for me compared to like any other school. I think that was also like a big push for me to kind of just like full send and apply just to Wayne State early decision, because I knew like kind of where I stood, and I knew that I really wanted to come here, and like everything in their mission and vision was like everything that I wanted in a medical school. And I know, for example, maybe if you're out of state, like that might be a harder decision for you to make. Whereas like I was just already in state and I wanted to stay in state. And then another part of this question says, does it matter how early? Okay, I don't think it matters how early you apply for the early decision program. I think as long as you make it before their deadline, because they do all the interviews within the same 2-week period, and everyone receives their acceptance on the same day of October 1st, or it was October 1st or 3rd, I'm pretty sure. But everyone receives their acceptance on the same day. So they kind of get a chance to interview all the applicants. And so no one like hears back before anyone else. So as long as like you get in by that like beginning of August date, I think I applied like end of June, because that's like, or end of July, that's when I got my MCAT score back. So I don't think it matters as long as you just like get it in by their like end date. So you do have a little bit more time to decide like if that's what you're worried about. So it won't affect whether or not you'll get in. Again, I applied like end of July and I still got in through early decision. I hope that answered your question entirely.
thanks, Lyle. I think Ahmed has a question, so go ahead.
Hi guys, thank you for holding this. I just had a question. It's kind of tied to what Lyle was speaking about. I'm planning to apply from Ontario, so I believe I'd be considered out of state. And I was just wondering what would be like an ideal or optimal timeline for applications. I know like end of August, like Lyle said, is when she applied for the early admissions program, but I was just wondering for the normal MD program, what would be an ideal sort of timeline?
This is Dawn. So early admissions decision or early decision program, you must have an application in no later than August 1st. And all your transcripts must be in no later than August 1st. So that's for early decision. Our deadline is not until December 31st for regular admissions, but we encourage everyone to have an application in by September. We continue to do interviews, but it becomes less and less likely that you'll get an interview the later that you wait past September. We will have our first interview day this year on August 5th, and interview invites started going out yesterday.
Thanks, Dawn. We got, oh, sorry.
Thank you.
We got a question in the chat. Can we each talk about how/who you got your letters of recommendations from? So I guess I can talk a little bit about mine. So my letters of recommendation, I tried to get them from teachers and mentors who actually knew me the best. So one of my letters of recommendation was from the volunteer coordinator at the downtown boxing gym, which I brought up in my introduction. He was the person who managed all of the college and student volunteers that were helping the inner city students. And I just got really close to him, seeing as how I was coordinating the students from the University of Michigan. And it was kind of one of those relationships where I was emailing him every week about new events that he wanted us to do, and yeah, and things that we wanted to try in the program. And in general, I would say try to find people that best know you and can speak to your character. My other letters of recommendation were from a biochem professor who I had in college. I was having a little bit of trouble with biochem, and so I was going to his office hours like every week as much as I could, trying to understand what was going on, because it's, you know, biochem's tough. And yeah, he was just someone that I got pretty close with, and I thought could speak pretty well to my character and my work ethic. And my other letter of recommendation was from my research PI. He was a surgeon at the University of Michigan, and I actually got that job during my gap year. And so I basically dedicated all of my man hours to doing all of his research projects. And I thought that I was having like weekly meetings with him, and I thought that he was someone that knew not just my work ethic, but like my personality pretty well, and how, seeing from like a physician aspect, like how I would do in the medical field. And yeah, and someone else can answer too.
I just wanted to add to this because this is one of the like things that I struggled with my application, just because, okay, so I was like a chem major in undergrad, and so I like saved my humanities classes to my senior year, but then I was like applying the summer before my senior year. And so I like, when I was like talking to like the pre-med admissions, they're like, yeah, you want a letter from like a humanities professor. I'm like, I haven't really had one of those. And so I had like one class that I had like a large class in, and I like asked that professor anyways. And I like kind of wish I didn't. So I like had one chem professor that I was like close to, went consistently to office hours, my research PI, and then like that other professor. And I wish I just picked another. I mean, I got everything worked out in the end. I'm here and all, but like, I do think you should, you don't have to follow a perfect format. If the people who know you like are all somewhat in the same field, like it's not like ideal, but it's more about you and your personality, and you want them to say like different things about you, but you want them to not write a form letter. Like that's the most important thing.
I think,
Oh, sorry. Leah.
No, you're fine. You're gonna go first?
Yeah, you go.
Oh, okay. I was gonna say, I think one thing is, even if they are in the same field, I think it's good to have people that can talk about different aspects of you. So for me, I had my orgo professor, but he was also my like research mentor. And I had also like worked with him as like an e-board member of an organization. And so he knew me like really well, like academically, and like me in like leadership roles, me as a student, me as like a mentor. So he was someone that could speak about different sides of me, because like you don't come to medical school just as like an encyclopedia. Like you need to be like a very human person and like be able to communicate well and hold leadership positions. Because like I will say, like the hard part, like once you're in medical school, it's not about how smart you are, it's like just about how hard you'll work. So I think having people that can speak to different sides of you is really important. Another one of my letters came from a doctor who I had like shadowed and had seen me like interact with patients, because he let me do a little bit of that. And another one was like someone where I had like volunteered and also held like a leadership position. This place called World Medical Relief in Southfield, where we package medical supplies. And so they like had seen me in that aspect. I could talk about like that version of me. And that will inherently display to the medical school, like, oh, here are all these different sides of this person, and this is what's making them well-rounded and a great addition to our university.
Yeah, definitely just reiterating what everybody else said, but I think it's less important about like the specific field, like science versus humanities, and more about what you've done with each person. I did a research mentor, but I did philosophy research, and I did someone who I worked with in a clinic that was actually still associated with Wayne State. So if you've done anything associated with the medical school, I would say that's a great person to ask. And then I did just a human physiology professor that I had same thing, gone to office hours with. So even if it's a class that maybe you didn't get like your highest grade in, but you had a lot of face time with that professor and they can see how hard you work, that would be a great thing to capitalize on as well, I would say.
Thanks, Shirley. Tony, you can go ahead with your question.
Hello. Since it was brought up previously, I wanted to ask about how you guys prepared for your interviews in terms of what sort of resources you guys used, and also, I guess, what kind of perspective you guys held while sort of approaching those questions.
I can go ahead and start on this one. So just like preparing for interviews, I remember there's this, you can find it on Google, there's like this big document of like 101 like medical school interview questions that will kind of give you like everything under the sun. And I had like personally just like went through it and started thinking of like what kind of answers I would have. And the whole goal is like not to have like a robotic response, like one that you memorize in response to those questions, but just like learn to have an idea of like what you might say, because some of them you really do have to think about and like reflect upon to come up with like an answer that's important, that's like relevant to you. Because again, you don't have 10 minutes to think in your interview, you have like 60 seconds tops. And so what I did is like, after I kind of went through it myself, I would just like every day I would have like a different person in school that I would find, or if we had free time, I would just like turn my laptop to them and I was like, ask me any random question, and I would just practice. I was also just lucky enough that one of my friends who is a medical student here in the year above us, he had like offered to give me like a full practice like interview of just like, he would go through and pick some of the questions he wanted or things he thought were important that like I should like be prepared to possibly get asked. And like, because he had already went through the process, he kind of was like, hey, like your response here was good, your response here was like a little bit weaker, and asked me questions that honestly like never thought maybe would like cross my mind. I think that's really helpful. You can also find like a lot of like practice like MMI scenarios like online, because like there are certain things that are like methods to like answering questions. So it's not necessarily like your cookie cutter answer, but it's like, oh, here are things you want to hit in your like MMI of answering, like what do I think of this situation, like what would I do. So there are like certain techniques that can just like help you like be organized in your answers for your interviews, and that's something that personally just helped me a lot.
I can go next. So I think I kind of hold almost the exact opposite. I really didn't prepare that much when it came to interview questions. I think the one that I prepared the most for was, why do you want to be a doctor? Why do you want to go into medicine? And I never got asked it in any of my interviews at any of the schools. So I kind of went into it with the mindset of, okay, think of maybe a time when you had a challenge, a time when you were a leader, but really kind of what Lael said earlier, how when you reflect on your experiences, you're going to be able to talk about them. And so in your interviews, if you've done that reflection beforehand and you've really thought through those things, you shouldn't have to do too much to prepare, because you don't really want the cookie cutter answer. You don't want an answer that sounds like everyone else's. I know at my Wayne interview, I talked about how I was a waitress for about 20 minutes with the interview lady, and I thought I bombed it, because who would care about being a waitress when you're applying to medical school? But so I guess just don't be over prepared with the cookie cutter answers, but then also having the reflection on the experiences that you've had and putting meaning behind the experiences, so that you're able to talk about them. That would be my advice.
Okay. I just have a small thing. The ones that I prepared for the most were like the MMIs, just because they were so different from like anything I'd done in other interviews. And so like that like 101 questions was like super helpful to just like run through with anyone you know who's also like applying, just like go back and forth and practice. One fun fact is that some of those MMI questions, like they'll be like role-playing scenarios. At least in our year, we didn't have like role-playing scenarios in Wayne State. And I thought one of the questions was asking it to be a role-playing scenario. And I really made a fool of myself, like talking to the person as if they were like the person in that situation. And so I did severely embarrass myself for a good 2 minutes, but like, so just an FYI, I'm pretty sure Wayne State consistently does not do role-playing scenarios. You just talk about how you would deal with this situation. What's the situation? Like the whole, it's STAR method, I think it is, situation, thoughts, like action, reflection, and everything. Just like it's really just like open discussion. They want to see your thinking and your critical thinking.
Yeah, and just a final point before we all sign off here, because we're reaching the end of our time. I think one of the things that I really tried focusing on, because I had a couple interviews early on and I was like literally trying to like memorize a script, and I realized that that's definitely not what you should be doing. One of the things to remember is that if you get an interview, we want to know who you are specifically. We want to know who you are genuinely. You don't want to read off a script the whole time and memorize each answer. You want to just be yourself as much as you can. And even Julia brought up that like it's okay to mess up in these interviews. Everything doesn't have to be perfect, as long as they can see who you are as a person, and if you're a good fit, then it'll go well. Yeah.
Even just one very final piece of advice, just for you guys real quick, just for your interviews, I know it sounds like very annoying to say be yourself, but really just be like very honest, because the whole point is they want to see that you are human, you are yourself, you like can fumble and mess up and make mistakes. Because I remember even telling like my interviewer, like my faculty one, that I was so nervous for the interview. Like I had to sit there and watch like a Netflix show like the 5 minutes prior to my interview starting, because I was like so nervous. And it was like a show that her daughter watches that she hates. And we kind of just had like laughed about it. And then she was like, oh wait, we should start our interview. So like that will not like delay just like even just like having conversation like you would with a friend. I feel like is kind of like the best approach to your interview. Imagine you were talking to someone like who's your friend, because like no one in your interview like wants you to like not succeed. We just want to see that like you are a person with a life like outside of medicine.
All right. Thanks, everyone. I believe that's all the time we have. I did want to mention that we have more events coming up in August, so watch out for those. And they will be on, I think there'll be more topic conversations about some, more questions about the interview process and application process in general. So look out. All right. Thanks, guys.